Good afternoon, everyone, and you are welcome to our platform, the Center of Excellence in Migration and Global Studies of the National Open University of Nigeria. I am Gloria Aneto, and on behalf of the Vice Chancellor of the National Open University of Nigeria, Professor Olufemi Peters, I welcome you to this monthly webinar, which has become our culture to always present interesting cases here. And our business is migration. This center was established about 5 years ago, and we were saddled with migration responsibilities and activities. The core mandates for the center include, but not limited to, the following: to provide leverage for field-based and solution-driven research, to serve as agents of national policy for migration studies, to seek grants for academic activities and outreach for sustainability, to publish and sustain peer-reviewed academic journal and monograph. We are concerning our journal is called International Journal for Migration and Global Studies. We are on our 5th volume and issue 2, because our issue 1 is going to be online for some time before we now produce print copies. So the journal is continuously progressing. We collaborate with stakeholders in the field and policymakers, and also to organize occasional seminars, conferences, and public lectures. Of course, ours is not occasional now. We do it often. And just to tell you ahead of time, we are going to have a workshop in the coming months in October, scheduled for 14th and 15th. Though that workshop, because it's a workshop, we are going to have it physically, not online. And that will be followed, by God's grace, in February 2026. By the end of February 2026, we shall be having another international conference, which will be our 2nd international conference. This year, February, we had our maiden one, our first one. So we're going to have one next year by God's grace. And all these activities, are all research-oriented activities. So the center is a research center, and so we are living and keeping up to our mandates. And so we are not going to waste too much time talking much about what we do in the center, but we have to always repeat these things so that some new people who join us, we really know what the center is about. And I just want to also tell you that we have our social media handles, and the administrative staff will post them to the chat board right now. We have LinkedIn, we have YouTube that has been since its existence. We have Facebook, LinkedIn, YouTube, and so on and so forth. And we are going to post those links for you to go to our center and see our activities. And of course, our journal is also very much conspicuous in these our social media handles. Having said that, I would want to go straight to introduce the presenter of today. This is a professor of a very scholarly professor, and who has a very good focus in research. So I'm very proud to have him here today, because his name is no other than Professor Emmanuel Ifeanyi Obiagu, a distinguished scholar, researcher, and leader in field of medical laboratory science and hematology. And why I'm happy for this, because some people believe that medical sciences does not have a stand in migration activities. Today, we are going to listen to this prof, who will also join the voices of others to say medicine and migration are two inseparable disciplines. He has a PhD in hematology and a professor of hematology in African University, Mutare, Zimbabwe. He is the current head of Department of Biomedical and Laboratory Science, Africa University, Zimbabwe. He has dedicated his professional life to advancing laboratory medicine, clinical diagnostics, and global health. with a particular focus on hematologic disorders, coagulopathies, and the impact of migration on health systems. Throughout his career, Professor Obiago has made seminal contributions to the understanding of platelet function, thrombosis, and hematologic biomarkers in the context of cancer, infectious diseases, and chronic conditions. His research integrates molecular science with clinical practice, improving early detection, treatment monitoring, and patient outcomes. He has published extensively in high-impact journals and is recognized internationally for his contributions to laboratory diagnostics and translational research. Professor Obiagu is also a visionary in global health, exploring the interplay between human migration, disease epidemiology, and laboratory systems. He has led collaborative research projects across Africa, Europe, and Asia, focusing on sustainable diagnostic strategies, workforce development, and healthy equity. His work emphasizes the critical role of laboratories in responding to global health challenges and fostering innovation. A dedicated educator and mentor, Professor Obiago has trained and guided hundreds of undergraduates, graduates, and doctoral students, cultivating the next generation of medical laboratory scientists. He is known for his leadership in capacity building initiatives, professional development programs, and cross-border research collaborations. Professor Obiagu has been recognized with numerous awards and honors for his excellence in research, teaching, and service to the scientific community. His career exemplifies the integration of scientific rigor, global health leadership, and a commitment to improving health outcomes for both migrant and resident populations. Now, let me tell you a secret about him so that you people can know. This professor before us is a proud alumnus of the National Open University of Nigeria. So up now, we are doing great because he has at least one of his degrees from this university. And I will allow him to say the degree by himself. But I have just given the gist out for you to start to ponder. So today, he will be talking to us about migration, global health, and the quest for sustainable medical laboratory research and diagnostics. So I welcome you, Professor Emmanuel Obiago, for agreeing to be with us today. At my first approach to ask him, would you make a presentation? Without a no, he said yes emphatically. So I appreciate you for that consent. And so you are welcome to present, and you've already been made a co-author. Sorry, I said a co-author, a co-host to present on this platform. So over to you, sir. Thank you.
Thank you, Beto. I am so pleased and so highly excited to be welcome here today for this research and which translates to development for humanity. I remain Professor Emmanuel Obiago, and I want to appreciate all the people here, starting from the Vice Chancellor of National Open University. I appreciate all the professors here, all the academic staff, the non-teaching staff, all my friends across different continents who have joined us today. So I'm so happy today. And I want to appreciate in a special way my mentor, Professor John Aneto, a seasoned professor of chemical pathology. Thank you so much, because I think I am seeing you there, and I'm happy to see one of my mentors here today. Thank you, Prof. And thank you, Professor Gloria Neto, for this opportunity for me to pray in your center. And I also want to re-emphasize what she said, Yes, I am an alumni of National Open University, Nigeria. I I have my master's there, MSc in public health. So I also want to National Open University, Nigeria. Thank you so much for helping me. Thank you for grooming me. Thank you for imparting the knowledge to me. And thank you. And then I will start my presentation. Thank you so much. I will be presenting on a topic entitled Migration, Global Health, and the Quest for Sustainable Medical Laboratory Research and Diagnosis. You can see the picture I put there. You see a man with a bag behind and dotted arrow pointing towards another direction, having a destination and having some signs of a map showing a direction of where he's going. You can see the point of departure and you can see the point where he's heading to from one location to another. Because we are looking at migration, we are looking at global health, we are looking at a sustainable medical laboratory research and diagnosis. And of course, you see a sign of globe, you see a sign of medicine, you see a healthcare worker with a stethoscope. And that shows that the migration also affects global health and also affect the workforce, which helps to maintain the health of humanity or the population. And then which translates to sustainable medical laboratory research and diagnosis, because migration has both positive and negative effects or influence upon both the host country and then the country of origin or where the departure country. So you can see the microscope which depicts laboratory medicine, and you can see a green leaf inside a test tube, which is a sign of laboratory test, and that green leaves shows a sustainable medical laboratory research and diagnosis, which when sustained will translate to positive, improved global health worldwide, which everybody is going to enjoy. So laboratory medicine is a medical specialty involved in the selection, provision, and analytical testing and interpretation of test results using a specimen from patients. Medical laboratories where these tests are carried out on specimen in order to obtain information about the health of a patient with regards to diagnosis, treatment, and prevention of a disease. So a migrant can now be defined as a person who moves from a place to another in order to find work or better living conditions. Migration may be voluntary, in this case, economically motivated, or it could be forced. And each of these forms of migration present with different health challenges. Some of these challenges are related to where people come from, where they go, how they go. So, and of course, we can never stop humans from migrating, because humans are not trees, humans are not meant to be sedentary. When you remain sedentary, it also has its own life health challenges. So human beings must continue to migrate. They will migrate either voluntarily or involuntarily, either by force or by preparation. Because today, there are a lot of crises in the world, a lot of crises in the developing countries. People may be forced to move out away from their homes. Sometimes they know where they're going, and some people may not know where they're going. And this has a serious effect or burden or challenge to the global health, the health of humanity. Anyone that says that is not involved, it also affects the health, both in a way of emerging and re-emerging infections, diseases, both communicable diseases and non-communicable diseases. There was a time, particularly Africa, even Nigeria, what burdened them most was microbial infection. But these days, it's no longer the issue of only microbial infection as a result of environmental challenges, personal hygiene, environmental hygiene. No, but these days, there is a shift from developed countries, issue of non-communicable diseases, particularly cancer and other cases that are now being shifted also to the developing countries as a result of issue of migrations, and then maybe because of the food that are being imported from different parts of the world. So over 200 million people migrate every year for economic reasons. The number of people who are forced to move for reasons of conflict is also growing. People flee across borders and become refugees, while at the same time, millions of others are forced to flee from their homes to remain within their own border. And these people are regarded as internally displaced persons. Or you will be hearing of internally displaced camps or ID camps. Migration is one of the most powerful forces shaping the dynamics of global health in the 21st century. I hope you people are hearing me. Hello.
Yes, we are
Hello.
together.
Very clear, very clear.
We are hearing you. We are hearing you. Hearing you clearly.
Oh, thank you so much. Thank you for that. Yeah, I'm happy about that. So, driven by globalization, socio-political and instability, economic disparities and environmental degradation, and climate change. Particularly this climate change is affecting a lot of things in the world, and that is why a lot of research are going on there. Even when you apply for that, the donor agencies are so swift in granting it for you, releasing what is involved for you to carry out the study, because the life of human beings are now somehow dangerously affected with climate change. If you watch certain things that were happening in January, may be happening now in March, and it has its own implication to health or the global health. Millions of people are also on the move each year, either voluntarily, as I said before, or involuntarily. And this mobility, whether internal or cross-border, temporary or permanent, has profound implications for health systems and the provision of essential diagnosis services. Of course, this mobility also affects the laboratory services that should be rendered to the people of the society, because people are moving from one location to another location. One is that there are a lot of skills that are lost from where they are migrating from to another location, where there is also increase in the skills that are transferred there. And again, while they are migrating, there could be some diseases they also migrate with, which is not, the host countries are not suffering from that. And also the number of people who migrate will also overwhelm their laboratory services, and you will understand that the 70% of clinical decisions are made with accurate laboratory diagnosis. Because if you're able to find the actual cause of a problem, sometimes people are dying, they say it's a mysterious disease. When they have not known the exact cause of the disease, they may term it mysterious. People are dying mysteriously, and some people will call it different names without knowing that maybe likely there are some organisms, there are certain diseases that have been transferred while people migrate from one location to another. And that's supposed to call for preparedness or preparation to avert the dangers, and then also to tap from the benefit, the advantages associated with migration. In the realm of global health, migration is a double-edged sword. On one hand, it contributes to the spread and re-emergence of infectious diseases, alters patterns of non-communicable diseases, and also challenges host countries to provide inclusive healthcare to diverse population. On the other hand, migration also facilitates the cross-pollination of ideas, knowledge, and expertise through the global mobility of health professionals. So the challenge here would now be how to navigate, manage these complexities, and then extract and make use of the benefit associated with that. In as much there are challenges there, but there are also benefits, especially the cross-pollination of ideas, knowledge, and expertise in global mobility of health professionals, and then research. Of course, we have to tap from the benefits, because even when they migrate, they have not died. Even the country they migrated from, supposed to tap from the wealth of their experience, where they migrated to, supposed also to benefit from their knowledge and the ideas they will release there to make the health of human beings to be better. So medical laboratory research and diagnosis occupy a central role in this discourse. Laboratories form the backbone of modern healthcare by providing accurate detection, surveillance, and monitoring of disease. We are in era not when you go to, maybe when you go to the hospital, you say you have fever, your temperature is very high, you have malaise and this and that, and then the doctor will just write white clerk in you, And then we will write the drugs immediately without sending you for laboratory investigation. We have passed that era where you don't know what is wrong with you. You have every right to ask the doctor, please, can you tell me what is wrong with me, so that you know the exact cause of the problem. So in fact, it is estimated that up to 70% of clinical decisions depend on laboratory investigation, according to the Howard research and Higgs and his colleagues. So there is a report that Nigeria, for the last 5 years, between 2019 and 2024, lost 14,000 medical laboratory scientists in the last 5 years, as reported by AMSIN. You can see that in the website of AMSIN, and also you see it in Daily Punch, which was published in May since 2025. As migration reshapes global health, laboratory system must adapt to the new realities. Emerging infections carried across a border, rare diseases presenting in unfamiliar regions, and migrant population with unique diagnostic needs and vulnerability. I'm sure all of us here, I'm sure the memory of COVID-19 lockdown, none of us has forgotten what the countries, different countries all over the world passed through in the hand of the emergence of COVID-19. It came, a lot of people died, a lot of confusion up and down. People were running up and down, head and scatter. In fact, within that period, there was a trip I was supposed to make to one university in the southwest of Nigeria, and the vice chancellor called me and said, please, Emmanuel, don't come, because there could be likely a lockdown, and you'll be trapped. You will now lose contact with your family. And within a short time, before I know it, there was a lockdown, which I would have been trapped somewhere, and I wouldn't move again. Businesses were affected, a lot of lives were lost, and so many things. And then many people begin to realize the need of medical laboratory scientists, the need of medical laboratory professional laboratory medicine, because it is still in the lab where you will identify what is actually happening, what is really causing this problem. And of course, some of the persons in the hospitals, like in China, died, reducing the number of workforce, and then the world were crying for help, because if all these health experts die, what happens to humanity, even though God has a way of helping human beings? So however, laboratory medicine faces a unique pressures in this context. The migration of skilled laboratory scientists from low and middle income countries to wealthier nations has created diagnostic gaps in already fragile system. So this drain undermines local capacity to respond to epidemics, hampers surveillance of endemic diseases, and widen global health inequities or problems. Of course, when one disease or epidemic there is an outbreak, people will think that that is the end of it. Nobody wishes the society and everything, but the diseases will continue to exist as long as human beings exist. As long as human beings migrate, the disease will be there. And what do nations that are wise do? They have to have a very solid, a very strong laboratory service, in such a way that whenever it happens, they go to the lab, identify, characterize what is exactly causing the problem, and then they prove a solution, and then people will not be thrown into confusion. Simultaneously, the sudden influx of migrants into host countries can also strain diagnostic capacities, leading to backlogs, delayed intervention, and reduced quality of care. Maybe the country where you are going, maybe their number is 4,000 or 4 million, and then people have come to join them. So the services that are rendered for the people that were there will now increase. But the question will be, has the number of professionals, healthcare workers, has the number increased, or the number is still there? Because where you are migrating, are they ready to employ you to work in the hospital, or they will give you other jobs that is not associated with your profession? And in that case, the population is increasing, but the rate of the ratio of healthcare workers to the citizens or the people in that society is incommensurate, and that is why sometimes you see burnout syndrome. You see people are overstressed in the hospital setting. People are overstressed everywhere. You see someone working for so many times overnight and whatever, so stretched. And the next thing you may notice is that the person has collapsed and died. And with all the training, with all the investment, with all the money, all the prayers, and then it will just be like the destiny has been cut short. Of course, we have to manage this trend very well and then maximize the opportunity. Yet migration is not only a source of challenge, but also a reservoir of opportunity. So don't just look at it from a point of a problem, because maybe like our people at home, they may be saying they are losing a lot of their health professionals or other professionals. The young folks are moving out, maybe in search of greener pastures, in search of maybe to further their education, or maybe for other reasons they travel, or maybe for health purpose or any other thing. Of course, we should begin to look at the benefit associated with that, not just as a challenge, but also it is also a reservoir of opportunity, because there is a cross-pollination of ideas, knowledge, and maybe research opportunities and collaboration and networking. So that diaspora professionals often contribute to knowledge transfer, research collaboration, and technology exchange, fostering innovation in laboratory science. Moreover, migration-driven health challenges have spurred the development of portable diagnosis, rapid point-of-care testing, and global biobanking initiatives. Of course, in the airport, there should be some of these rapid test kits that people should use. Trained professional scientists should be used to diagnose, to screen people who are coming into the country. And in that case, like now, if you listen, you'll be hearing that there is also an outbreak of Ebola in the Democratic Republic of Congo. Maybe in the country, somebody fly from there, they're supposed to be screened, they're supposed to be monitored very well, so that if they notice any sign of that, they follow the policies involved with the migrants, to ensure that the life of the migrant, the life of where he's also going, the people in that environment, is also safe. So in this sense, migration acts as both as a strength test and also as a catalyst for advancement of laboratory medicine. So the pursuit of sustainability in medical laboratory migration a role in global health. Sustainable laboratory system must be resilient, adaptive, and inclusive, capable of serving both native population and the mobile communities. So they must balance the realities of workforce mobility, resource limitations, and shifting disease landscape, while embracing opportunities for innovation, collaboration, and the inequalities. So of course, there should be utilization of laboratory services, and this the utilization of laboratory services will occur with innovations in laboratory medicine research, diagnosis, coming out with innovations with a good diagnostic tools, and of course challenges of some information or facts we know which may not be true. What may be true in 10 years last may not be exactly the way things are happening, because there are still a lot of issues that have eluded the scientists from answering those questions, which researchers should delve into it and find the answers, and then help humanity. And of course, let me say this, when people are going into research, they should tailor the research to the immediate need of their immediate environment, because the problem of Africa may not be exactly the problem of the developed world. So the research should be tailored towards solving the problems of the immediate environment where you are. So the migration as a global health determinant. Migration has emerged as a central determinant of global health, influencing the disease pattern, healthcare delivery, and health policies. So according to the International Organization for Migration, over 280 million people are international migrants, with an even larger number displaced internally due to conflict, disaster, and or economic pressure. Let me say here, even though with this figure that is given, I want to tell you emphatically, sincerely, that the real figure, the real documentation is you can't get it, because there are still, you have both legal migrants and you have even the illegal migrants, and all those people are adding to the population of different places they are going. Remember when I said that migration, we have a voluntary and involuntary by force, and whether willingly or unwillingly. Sometimes there are crises that drive people away from their communities, and they may be close to the border, they cross to another country. So this massive human movement reshapes population demographics and introduces novel health challenges in both sending and receiving countries. So migrants carry diverse health profile, encompassing prior exposure to infectious diseases, vaccination histories, and prevalence of chronic conditions, which require adaptive responses from healthcare system worldwide. Remember, when you are before you migrate, you have to take a history, you have to read more on the country where you are going, on the place you are going, you have to check so many things, both the economies and both the economic status, both some diseases that are so rampant there. How is the immunity status of the people in that environment? There are some cases that you hear it, you need to take a prophylaxis. You need to take, like now, if some Europeans are coming to Africa because malaria is endemic in Africa, some of them have to take a prophylaxis for malaria infection, so that while they come, malaria will not. For you, you will say malaria is a small thing, but malaria can kill them. But you have built immunity for that. But for them, they don't. Their immunity for that, they don't have antibodies developed in response to that, the antigens that is associated with that. So we have a table showing global health as migration as a determinant of global health. We have different areas, determinant area, disease transmission. So the cross-border spread of infectious disease, this will lead to cross-border spread of diseases, a kind of transfer of disease from one location, one country to another. And then under the global health implication, it will induce a heightened epidemic and pandemic risk. And then the laboratory implication here is that there should be rapid diagnosis, genomic surveillance, and mobile testing units. Under the health access iniquities or inequalities, migrants often excluded from national health system. You see, there are in different countries, they have different policies. They may have different policy for their own citizens. They may have a different policy for the migrants. And of course, as we are traveling, there are a lot of vulnerabilities with the migration. So this global health implication is that it wasn't health disparities and delayed treatment. And then the laboratory aspect of it, it should be affordable, it should be culturally adaptable and or adapted and portable diagnostic tool. That is the way to handle this issue. And then of course you consider the area environmental and climate migration, climate change on migration. So this will lead to displacement due to floods, droughts and disaster. And then again, the global health implication is that there will be increased vulnerability to malnutrition, vector-borne diseases. Then the laboratory aspect of it involves early warning systems and diagnostic preparedness for outbreak. Of course, in the management of disease or control or treatment of disease, it is always better for early detection. And then with early detection, a lot of dangers on people's life will be averted. A lot of patients die as a result of inadequate, improper, and inaccurate, and then untimely diagnosis of so many problems. Example like cancer. If you are not diagnosed early and it entered maybe stage 3, you know that is a problem. And of course, the person now needs the mercy of God. Socioeconomic vulnerabilities under the migration impact, there could be this may lead to poverty, poor living conditions, and occupational hazards. And then under the global implication, global health implication, there could be higher burden of chronic and then occupational diseases. So when you look at this, you see that the migration has a lot of impact on the global health. But of course, laboratory research and diagnosis has a lot of role to play to downplay, to reduce the level of impact, the negative aspect of migration. So, of course, laboratory will help to convert the challenges into an opportunity which a man can convert into blessings. So, infectious disease transmission and surveillance challenge. So, one of the most immediate impact of migration, as we stated there, is infection of disease dynamics. Of course, we should be prepared for dynamics in disease surveillance, pattern disease, pattern transmissions. So mobile population can introduce a disease to previously unaffected area or reintroduce a control infection. Maybe the disease that the country think they have already solved, the migrant may bring it from their own country, and then the country start, the Ministry of Health will be overwhelmed again and start running around to put it under control. Tuberculosis, HIV, hepatitis B, and malaria are in particular affected by human mobility. For example, multi-drug tuberculosis has been documented among migrants moving from high-burden countries to regions where historically low, because if you are discussing with some people from different parts of the continents, there are some diseases you mentioned, they will tell you they have never seen it in their place. Even though they are clinicians, even though they are medical doctors, but they will tell you that in their own locality, they have never seen it since they started practicing, meaning that those diseases are not there. But in your own location, the disease is rampant, is highly prevalent in every nooks and crannies. The COVID-19 pandemic further demonstrated how international travel has still raised the spread of novel pathogens. Consequently, laboratories must enhance surveillance capacity, molecular testing, and contact tracing to manage migration-related disease risk. Last time during the time of Ebola, I lost one of my classmates who was working in the nurse who was working in Lagos. Lost his life because of Ebola, which is also as a result of migration. We have a non-communicable disease burden in migrants. So the migration also influences the epidemiology of non-communicable diseases. So the migrants often undergo lifestyle and dietary transitions. Of course, you notice when you are traveling to other places that are not your place, you'll be ready that some of the food you eat in your place, you may not see them there, and it's going to affect your health. It's going to affect your immunological status. And that's also when there are some infections in that place which you have not developed immunity against them. Of course, it's going to affect the person. I remembered the first time I went to Uganda. Of course, people will be calling me, start cooking, you are dying. I will say, tomorrow I will start, And I was gradually dying because I was not able to navigate, to manage their own food. But with time, I adapted, and I know that I was able to navigate it, but I know that all migrants is not always easy for them, especially the first time they migrate. When you reach there, it's not the type of food you are eating in your place, and your place is no longer near where you can easily rush back and get those food you want, enjoy them and come back. So you must manage what you have within that environment and survive. And then experience psychological stress. Of course, there are going to be so many changes you will notice that's going to affect your psychology, because you're not even going to express your complete freedom. And that is why people will always tell you that home is home, and face a limited access to healthcare services, and all of which increase susceptibility to non-communicable diseases such as diabetes, hypertension, and cardiovascular diseases. Studies in Europe and North America have shown elevated prevalence of obesity and metabolic syndrome among certain migrant groups compared to native population, and it is because of eating, just eating to survive. This will increase obesity and then other metabolic syndromes. So laboratories must therefore be equipped not only for infectious disease diagnosis, but also for biochemical, hematology, and molecular testing relevant to chronic disease management among the mobile population, that is the migrants. So the health system also is also impacted on the host community countries. So the influence of migrants can also place a significant strain on the health system, particularly in low and middle income countries. Of course, if the population, the number of people coming in are not controlled or regulated, and then the health system, particularly the laboratory aspect. And of course, you remember that in most hospitals, they build a laboratory when they have finished building the hospital. So now, if there are some CEOs, CMDs that are listening to me, of course, when you are building the laboratory, please involve the people in the lab. Let them bring also their own country, their own ideas, and then build it. Like the other day, I was talking to my student and I asked them, do you know why blood banks are always supposed to be situated at the center of every hospital? Not just anywhere you want, because the blood is life. And of course, at any time there could be emergency, and some of saving lives sometimes need speed. It needs speed and accuracy. But if the blood bank is now far from the center of the world or where you are bringing the patient may die before you transfuse, you give the patient blood to sustain life. And I keep telling people, life is so precious. Life must be managed well. Sudden crisis in patient load can overwhelm diagnostic services, create bottlenecks, and compromise care quality. For instance, refugee camps in sub-Saharan Africa and the Middle East often face outbreaks of cholera, measles, or respiratory infections, where laboratory diagnoses are critically yet limited by resource constraints. So the host countries must adapt by expanding laboratory capacity and optimizing workforce development and integrating mobile diagnostic technologies to maintain health security. So of course, the host countries was where those migrants are coming, because some of the people now are looking at the laboratory aspect, the medical laboratory scientists and their role in controlling and regulating the global health, their implication on migration on that. So of course, their skills should be tapped, not just when they move maybe to developed countries. Some of them, they don't believe in them. They say you cannot touch their patient, you cannot collect sample from their patient. We don't believe in your training. Allow them, even if the training is not sufficient for the way you think, expose them to your own nature of training and allow them also to participate in managing their health and in accurate diagnosis, because the work will overwhelm the limited workforce you have there by the increase of the upsurge of the migration. And of course, the aspect of brain drain. Of course, even in our country now, Nigeria, of course, people are crying for brain drain. People are migrating. The young folks, the young men and women are migrating. You finish training them upon all the money both the government invests, the parents invest, the community, the university invest. You finish training them within a short time. They also migrate, and then causing a kind of, there is a vacuum at home, and then going to another country, place. I am not saying that there should be no exchange of knowledge, exchange of skills, exchange of maybe help. It should be there. But of course, one thing I suggest we should do, both the people at home and the people everywhere, the people outside should remember home, and the people at home should also receive the people outside. In that case, of course, you should tap from the wealth of their experience. Like for some of us that are in academics, of course, because the person left home is not a reason why the person cannot contribute in the development of their home countries. In that case, they can also teach online. They can mentor the young ones online. They can train them on online, and then time to time visit home and ensure that home is also home. And I urge all the diaspora people to always remember home. Time to time, you have to come back home and then, of course, contribute both to your village, to your community, and then to the country at large. So this brain drain reduces the local diagnostic capacity, weakens the disease surveillance systems, and undermine outbreak preparedness. Of course, you notice that maybe in a lab, in a hospital where they have 10 scientists before, now they may be having 3 or 4. Then how are these 3 able to do all the work, or 4, or the work of the population of the patients that are coming to that hospital? And in that case, it will also affect their life. I know of one hospital, every time in their platform, they will always be saying condolence, bereavement, saying message of people, this, that, and I'm sure it will not be traceable. It will not be far from stress. It will not be far from stress, so we have to balance it. Conversely, when managed effectively through policies that encourage temporary migration or diaspora engagement, this professional can facilitate brain circulation, contributing expertise, mentorship, and research collaboration back to their countries of origin. I also have another diagram, another table showing this brain drain among the health professionals. The workforce shortages. The impact of this will result to loss of trained doctors, nurses, medical laboratory scientists, and other health workers. But today we are looking at medical laboratory scientists, and then the implication on global health. It weakens a national health system, especially in low and income countries. And then the laboratory aspect of it, there will be reduced diagnostic capacity and slower response to outbreaks. Maybe if there is any outbreak, if we're supposed to manage to handle it within a short time, it may take a longer time. And taking a longer time may also result to loss of lives and skill imbalance. Of course, a highly skilled professional migrate to high-income countries. There are some countries, there are some developed countries, they have some policies that they are looking for the best all over the world. They are hunting for the best, the talented ones all over the world. They make it easy for you. They give you the green card. They make you to become their citizens because they know you are going to contribute favorably in the development of their country. They will attract you. Like now you come to academia, or in academics, there is a way your profile will look like. There's a way your citation, your HDS will look like. Some of them, they will recruit you. They will welcome you as an extraordinary researcher. And that is how you keep on hearing that this country is the world power, that this country is the #1 for this. Even when they release their university ranking, some of those ranked universities, the best universities, if you trace them very well, a lot of the people, these people doing it underground, many from Africa, and particularly even from our own country, Nigeria. So I also encourage our colleagues also to remember home in whatever achievement you are making. Always remember your source, always remember your roots. Training investment loss, countries lose a professional they have already trained. You have done a lot, both when they're in the university, both during internship, all of a sudden they all go, but many times they are going for good, because there's also something that is coming back home. So, and of course, the influence, the impact on global health, that will lead to wasted national resources and dependence on foreign aid, whatever that you want to do. Little sickness, people will be migrating, traveling to developed countries, things that would have been handled at home, they will be traveling to elsewhere, and that will increase the cost. And then the laboratory aspect, there will be difficulties sustaining advanced lab technologies locally. And then inequitable access. This may have like urban versus rural and migrant versus wholesale disparities will increase, will worsen. And then rural and migrant population underserved. And then limited diagnostic access in vulnerable populations. You look at the research, the implication of research and innovations, there will be migration. The migration reduces local research productivity, because maybe some of the experts in research must have been taken up by some other countries. Maybe either they are paying them higher, maybe the environment is secure, maybe the environment is safe, maybe the environment is good for them to train their children, and in that case, making the country of origin to lose those experts, and they will start training other people. And of course, it's just like in a country where you have more of aged, and then the young ones are going, that there is a danger, there is a problem in that kind of country. A country that is more of aged people. So when these people age, who is going to take care of them? Because life is all about the cycles. Life is in cycles. So we also have opportunity of knowledge exchange, because we shouldn't be talking only of maybe of a challenge associated with migration. It's present with opportunities for global health innovation. Migrant population and mobile health professionals stimulate the development of novel diagnostic platform, point of care technologies, and mobile laboratories tailored to resource constraints and transient population. And international collaboration facilitated by diaspora network and global health partnership enables knowledge transfer, joint research projects, and then the sharing of epidemiological data. Of course, I can use myself to cite a little example. I know that when I was in Nigeria, I know that I have the flare for research, but of course, as I move on, the level of my research, the interest I have in research continued to increase, and I expanded my collaboration all over the world. I have collaboration in research from different parts of the continents of the world, not just limited to Africa. And of course, I know that is exactly what other people are doing. So of course, there should be exchange, both free, even the diaspora people and then the people at home. Even sometimes, anytime they release the ranking of universities, I keep saying it that Nigeria is supposed to be among the best in the world. If we harness the potentials, the talents we have very well. Such initiative enhance the ability of laboratories to anticipate emerging threats and implement context-specific intervention. This table is to just explore, to explain it more. When you look at it later, you will get to understand it more. And then, of course, integrating migration to health policies. So given the multifaceted influence of migration or health, it is critical to integrate migration consideration into national and global health policies. So strategies should include the harmonization of diagnostic protocols, standardization of laboratory quality management, incorporation of migrant health surveillance into public health planning. By proactively addressing the health needs of mobile population or the migrants, and then leveraging on their contribution to science and innovation, policymakers can strengthen global health security, reduce inequalities, and then build a resilient laboratory system capable of responding to both routine and emergent health challenges. If we're able to harness particularly the mobile laboratory scientists, the lab professional, the medical lab aspects, the people migrating from one different place to another, we harness them well. Of course, I know that the rate of challenge we face for diseases may be drastically reduced. And I want to tell you that no one should be left behind. No one, according to Sustainable Development Goals, that no one should be left behind to ensure that there is best global health identify the SDGs identify migration as both a catalyst and also a driver for sustainable development. And then a clear call by SDGs is to leave no one behind, irrespective of their legal status, in order to achieve a universal health coverage for all. So there should be health for all, irrespective of whether a legal migrant or illegal migrant, because health for one is health for all. Someone may say, it is not me. I'm not the one that is sick. I am not the one that is dying. I am not the one that is suffering from COVID, from Ebola, from Lassa fever, and so many things, so many viral infections that are bedeviling man. But of course, you should know that the life of that one can also affect the life of the community, can also affect the life of the country, even the rich and even the poor. Nobody is shielded from diseases. Nobody is shielded from infections. It can reach anybody, especially some highly virulent organisms. Some of them just a little contact, little closeness by aerosols and so many things. People get the infection. So in many countries, however, equitable access to health services is considered as a goal only to the relation to the citizens. There are places you go, they may tell you that not you, as a migrant, you are not supposed to attend so hospital, you are not qualified, you are not eligible for that hospital. But of course, there should be coverage, there should be universal health coverage for all if you want to have a very nice global health, a globe that is safe, a globe that is safe for humanity. So additionally, internal migration is left out of a programming and policy intervention designed to support a universal health coverage for all. While universal health coverage aims at ensuring everyone can access affordable health systems without increasing the risk of financial ruin or impoverishment, the formulation of universal health coverage remains unclear regarding non-nationals or non-citizens. So while many international declarations state that the right to health applies to all, including migrants and non-citizens, many national policies also exclude these groups in whole or part. Some of them are not on paper. You may not see some of them on paper, so that you cannot hold them responsible. There are places when you are employed, you will notice that there are some certain benefits that you cannot access as someone that is not a citizen of the place. But nobody can officially translate that, because anybody hearing that, they know it is not good for people to hear such. So such may not be documented, but in the body language, it may be there. So migration and health research, two key focus areas, migrant typologies. Of course, you should check, you have to classify the migrants. Remember when I talked about voluntary and involuntary? Like when you're applying for visa, you will see that they will say, some of the developed countries will say that you will show your bank account, then they will tell you the time, the duration they want to check that bank account. What are you coming in their country to do? Are you going to be a problem to them? Are you going to contribute to where you are coming? So to assist in understanding the association between migration and health, our research must find ways to better capture and engage with complex, dynamic, and often intersecting migrant typologies. We must be careful not to cluster migrants and their associated life experiences to simple reductionists and categories such as internal versus cross-border, documented versus undocumented, or even refugee versus economic migrant. People migrate for different reasons, whether by force or maybe by voluntary ways. Those people, all of them should be classified, because each of them may also have some implications in regards to global health. And then we recognize the bidirectionality of the relationship between migration and health. Our research should explore how different forms of migration influence health at both individual level and population level, and also that shows also is also related to this universal health coverage. Migration trajectories can positively or negatively impact health outcomes, just like health status can affect migration outcomes, and this way, two ways relationship should be better reflected in research. So, of course, the research that should be carried out in regard to this should also help. And even while people are going out of their origin state, country of origin, a lot of data should be collected, which will be utilized for research. Even when they reach their state, the country where they're going, the research should also help to track even those that are going to asylum. And then the role of laboratory medicine. The laboratory medicine plays a significant role for this global health. So in terms of screening for specific diseases, in terms of diagnosis, in terms of monitoring effectiveness of the treatment, in terms of procrastination, in terms of quality of point of care, in terms of public health surveillance, in terms of economic value, in terms of research. And then the central role of laboratories in migrant health. As I said, in the context of migration, laboratories assume even a greater importance as mobile population often present with complex and diverse health conditions. So migrants may carry infectious diseases endemic to their countries of origin undiagnosed, because even though people are asked to go for medical fitness, medical examination, but sometimes what I observed when I'm at home, you notice that some of the tests some people may do may not even be what people may even exclude, undermine some certain diseases that are very important, which hello. So there are some conditions that may affect the countries they are traveling to, which is not considered urgent. Accurate laboratory diagnoses are therefore essential to guide clinical management, prevent disease outbreaks, and ensure continuity of care to cross a border. And then you will look at this the table, which I used to explain it more. You see some focus area, you see the migration linked challenges, you see the laboratory and the diagnostic needs, and then sustainable solutions. Because we are looking at sustainable, utilizing a medical lab to sustain medical laboratory services, which will now help to improve global health, especially in terms of migration. And then the focus area of infectious disease, of course, the migration linked challenges here will result to high mobility increases of tuberculosis, HIV, malaria, and then COVID, and all this we understand. Of course, you see some people will carry the disease, they are coming home, and you think they are well, maybe they look so plumpy, but you don't know that maybe the viral load or whatever quantification of the organism in them is very high, and they come back home and they transfer the condition to the people at home, or the people from home may go to another side and transfer some diseases. The laboratory and diagnostic need, there should be need for rapid portable diagnostic and cross-border genomic surveillance. Of course, the laboratory diagnosis should be simplified in such a way that it becomes easy, and a lot of persons may be trained to do that even at the point of entry to countries. And then sustainable laboratory solution here will involve mobile laboratories, regional labs, network, and AI-driven outbreak tracking. Of course, we shouldn't be left behind in the artificial intelligence applications now, even in diagnosis. And then the focus area of non-communicable disease, the implication is that there will be rising burden of diabetes, hypertension, and cancer among migrants. And then the laboratory and diagnostic needs will be affordable screening and long-term monitoring tools. And then the sustainable solution will be low cost if you're able to reduce the cost of laboratory diagnosis, because of course there are people now when they are sick because of the money involved with the laboratory diagnosis, some of them will not be able to visit a laboratory, and then their problem is not identified, and problem not discovered may not be problem half solved. But if you're able to track the problem, identify it, and know exactly the cause of the problem, you're almost done with the treatment and cure for that disease. Maternal and child health, limited, this will result to limited antenatal screening, which is very, very important, and nutrition and perinatal risk of humans come through the maternal process, through the birth. And then laboratory and diagnostic need early detection of anemia, infections, and congenital disorders. And then the solution, sustainable solution, will involve point of care testing and integrated maternal child diagnostic packages. The diagnostic complexity in migrant population. So migrants pose unique diagnostic challenges due to the heterogeneity of their health profile. Remember, not all of them are traveling from the same place. And even when they are traveling, not all of them are traveling under the same condition. There are people who are forced to travel. There are people, it is as a result of natural disaster with all the release there. Sometimes some people are traveling because of war. And in a case of war, you know that there are a lot of chemicals, a lot of elements, there may be heavy metals that are released within the environment, which also will also affect the pattern of non-communicable disease and even communicable disease in terms of cancer by affecting the bone marrows, maybe blood cancers and so many other cancers as a result of arms and other issues associated with war and other. For instance, a refugee from sub-Saharan Africa may present with malaria, multi-drug resistant tuberculosis, and hepatitis B, while also experiencing malnutrition and anemia. So migrants from Southeast Asia may present with dengue fever or chikungunya in non-endemic areas. So workforce migration and its impact on diagnosis. Of course, all of us know that the workforce, if you go to every hospital now, there is a reduction, low level of workforce in the hospitals. Many of them have traveled to maybe developed countries and then affecting the workforce and affecting the quality of healthcare given to the patients, especially when they need those care. They may not be attended speedily. They may not get their result timely. The result they're supposed to get in a day, maybe they may be getting them in 3 days or in a week, which is also going to affect the doctors in making a clinical decision to help the patient. And as again, the countries where they are going, it also has its own implication in diagnostic care. Of course, it's going to affect them, and as I said, many times some of them are not incorporated into the laboratory diagnosis. Of course, there are a lot of things you have to do before they will be accepted to practice in your new country where you are going, because they have to license you. They have to be sure that what you say you studied, what you say you claim you be, that is exactly what you be, so that when they allow you, you shouldn't go and kill patients. And then opportunities for research and pathogen surveillance. Migration presents unique research opportunities, particularly in the field of pathogen genomics. Of course, when you travel, when you migrate, you should be watchful. You should watch the uniqueness of where you have come. What are the opportunities you can explore for research? What is the disease pattern? What is the drug resistant pattern? What kind of diseases are challenging the people of that environment? From there, you should be able to be creative and then bring innovations, of course, and even have a networking that will also link there and link your home country. And then technological innovation driven by migration. Even though the challenges posed by migration have accelerated innovation in laboratory diagnosis, of course, in a time of a point of care whereby, of course, some people will just say, with just a little drop of your blood, they should be able to read the result. And then CRISPR-based assays now also allow for rapid, accurate detection of infectious agents, especially in resource-limited environment or mobile setting. Mobile laboratories often deployed in refugee camps or border clinics enable timely diagnosis of outbreaks such as cholera, measles, or COVID-19. Digital pathology, telemedicine, and cloud-based laboratory information system further enhance diagnostic efficiency and allow clinicians and researchers to share data across regions, monitor trends, and support remote decision making. So another aspect that is very important is data integration and cross-border coordination. They called me recently from Brazil to be part of some multi-center studies on cancer, and of course, this gathering those information, they will also apply it in artificial diagnosis algorithms in different ways, in performing diagnosis very fast, and of course, they are relating it to CBC, complete blood count. Of course, if they're able to get this CBC of this breast cancer patient, within a little findings, the questions they ask you, the diagnosis should be able to come out in seconds. And the diagnosis will be accurate and reliable and timely. So, of course, this will bring effective laboratory research in migrating a world which depends on integrated data. Continuity of care for migrants require harmonization of laboratory results across borders, while epidemiological tracking demands an interoperable databases that can monitor disease trends in real life. And vision for migrant response laboratory system, a forward-looking approach to laboratory research and diagnosis, integrate flexibility, equity, and sustainability. Laboratories must anticipate the health needs of diverse mobile population while maintaining high standards for quality and accuracy. This includes investing in workforce development, expanding access to cutting-edge diagnostic technologies, and fostering international research collaboration. Of course, we have to tap from the benefits associated with migrants, especially in research. And the people in the lab, the people working in the lab, they should know that they are pivotal, they are central, they are so important when it comes to the research involving a healthcare system. They should know that they have the data that are factual, the data that are evidence-based, and of course, they should be proud of that work they are doing for humanity. Then sustainable approaches for medical laboratory research and diagnosis involving investment in laboratory infrastructure. As I told you, Many times when you visit some hospitals, you see that they have finished building the hospital, and they now realize that there is no laboratory for that hospital. And some of the toilets they have built, the toilet the people have even started using, they will now convert it to laboratory. And when you come to see the people working in the laboratory, even psychologically, you see that they are not motivated in most cases. And then the workforce, the people working should be motivated so that they give out their best. And of course, you see how if you go to some of them, even the reagents they have supposed to be kept under some regulated temperatures, but of course you see that the temperature there may be very high, but what you are having there may be very high temperature, maybe exposure to directly sunlight, which destroy the reagents and then brings about having inaccurate results. I remember that when I was working in the lab in Nigeria, there was a time that we bought reagents for ABO and screening, antibody blood grouping, and I realized that everything you do, we are getting the same results. So we have to do quality check, quality control, and we realize that what they supply to us is not potent, is not efficient, is not good. We have to return it back to the supplier, and of course, we tell them don't give us this kind of thing again. But if we have not done quality check, or maybe nobody was called to say this is not good, this is not normal, and then we release a wrong result, which will also tarnish our image without knowing that it is not maybe directly human error. It is maybe a technical or reagent or equipment error. So the workforce development and retention, the workforce should be developed, more empowerment, more training a lot of staff, a lot of young ones, and then not just training them, there should be policy of retaining them, policy of making them happy, because if you are happy, what are you looking for anywhere? Policy and the governance framework, technological innovation for adaptation and accessibility, and then international collaboration and partnership, very, very important. We need to utilize a lot of international collaboration. It's just like sometimes some people there are certain things, maybe people are coming for accreditation in the university. They are looking at the publications you have. How do you collaborate within the department? How do you collaborate within the other departments in the faculty? How do you collaborate between other departments? Interdisciplinary collaborations. And then how do you collaborate within the country? How do you collaborate within the continent? How do you collaborate outside the continent? And some of those things, God harness very well, has a lot of impact to make within our society. And then again, financing and resource mobilization, especially as we know that our society, not everybody is rich. Of course, there should be a way to make the finance, the cost of healthcare to be affordable, accessible for the health, the citizens. So vision for sustainable migrant responsive laboratory system, there should be a very good laboratory. So I advise countries to have a strong, sophisticated laboratory built to help humanity for a quality, reliable, accurate, and timely diagnosis to save lives.
So
and then you see in this table.
I want you to round up, please round up in the next 1 minute.
Okay, thank you. Thank you. Let me now go straight to some of what I've learned within the few time I migrated, which may also add a value to other people, which I know that most of the persons listening to me are well-experienced people. They have also migrated. Of course, anytime you migrate, there are certain things you will learn. I encourage people as you migrate, look for things that are good, get those things that are good, also add it to your home countries. There anything you know that other people are doing that you met, as you migrate, also bring it home, bring innovations home. So one of the foremost lessons I learned is emphasizing the critical importance of adaptability. So when after being trained, don't just go to anywhere and say it must be the way you are trained. You must be flexible, you must be adaptable, you must bend to the regulations, the policies other people have. You come, you watch how they do their things, you learn how they do the things. In that case, you must be ready to learn. So in this, I understand that you also need to be flexible because healthcare system is evolving rapidly in response to migration, emerging diseases, and a shifting landscape. And then again, integration of research and clinical practice. I have also observed that it has a positive effect on research output. And I encourage all of us to maximize that opportunity in quality of our research. And then the importance of workforce development and mentorship. It will help you to see many persons you mentored. You will mentor a lot of people which you wouldn't have had opportunity to meet them in life. You will meet a lot of people, give them some skills, knowledge that even when we leave this world, you know that you have contributed to the well-being of humanity. And then collaboration as a catalyst for innovation. Of course, it's going to enhance, and you observe
I think
that
you
it
will
enhances
conclude
my.
so that people can ask questions. So just conclude,
All right.
yeah, so that we can ask questions and
Thank
clarifications.
you, Prof. So then, in a nutshell, you can now see that this is a triad. The impact, the role of migration, and then the global health is at the center, and then the medical laboratory science is at the other end. So now, if we're able to, yes, we know we can't stop people migrating, but I now advise that we should now reinforce, we should train more healthcare workers, particularly medical lab scientists, and we should have quality laboratory services that will be ready to withstand both the challenges and then, of course, start from the wealth of the knowledge and the skills of these migrants. And with this, I believe that the world will be a better place, a safe place for all humanity. Thank you so much for listening to me. Thank you.
Thank you very much, Prof, for this wonderful presentation. I really enjoyed every bit of it, but not to deprive others so that they can ask questions. I can see Professor Tijani's hand up. Of course, apparently that's the only one. I don't know that Professor Abdallah is still online. You said you will
Yes,
leave by 1:30.
I am
Okay.
online, and but I can't seem to get my gesture up. For some reason, my gesture seem to just simply disappear
Okay,
on
but
my
so that
system.
means
So,
I
but
assume maybe your physical hand
yeah,
is
my
fine.
hand is
No
up.
problem.
Yeah.
That's okay, sir. No problem. So let me just say I appreciate that. So I must say what I enjoyed most is integrating migration into global health policy. I think if it has not been done, this is one way we have to let this your lecture reach out and we write some kind of communique and all that so that that can be done. And if it has already been in the policy, then to see how we can make it more effective. And of course, the issue of mobile laboratory that has been on for years, how active, how workable is it? Or are we leaving leaving it only for the whites, for the developed world? In Nigeria, I know you are not in Nigeria right now. How workable is this mobile laboratory? I want you to clarify that. But before then, let me allow my senior colleagues and colleagues to make their comments. Over to you, sir, Professor Abdallah, after which Professor Tijani will speak. Thank you.
Thank you very much for giving me the opportunity. As I privately informed you, I have a class at 2 o'clock, and I have to drive to the university from my house, which is about 20 minutes. My observation is that, as usual, what we have are theoretical basis. What should be, what should be, rather than what actually is. And probably this is because being a scientist, I'm always looking for an empirical evidence that connects independent variables with dependent variables, so that at the end of the day, we have a clearer picture of what we are dealing with. For instance, part of what the lecture talks about was screening of new immigrants. Now, these new immigrants, like you are going to London or America or Germany or wherever it is, naturally you have to provide health insurance, you have to provide all those things. So the companies that handle your health insurance, travel insurance, and all that, presumably screened you before they give you the insurance, which will enable the embassy to give you a visa. But what about irregular immigrants? How do we capture them? Because people don't want even be seen. How do we get them to be captured and check their health regulations? You're saying that they should check health regulations of the country they are going. People don't care about the health regulations of anywhere. All they want is to get out of the country. I mean, if you are familiar with the migration studies of House of Home, you will see a lot of videos on TikTok and Facebook reels of young people migrating from northern Nigeria through the desert to Libya and so on, and acquiring diseases along the way going over there. These people don't go through any particular process of checking health and so on. So how do we prevent those kind of things when they are moving irregularly? We won't even say illegally, but irregularly. So this is a critical question. How does all this laboratory awareness, disease surveillance affect irregular immigrants who steal their way into various countries? So I would have loved to see cases, empirical cases of diseases connected to migrants in in various countries. For instance, Ebola broke out because of some Liberian guy who gave who took it to America, and then from America he came to Lagos, and then the next thing you know, the disease was spreading all over. So, if there was an outbreak of disease or incidences of diseases in some of these countries, I would like to see something that connects them empirically, directly to migrants. That way, I would know that migrants pose health risk to this country, and I would have loved to see that kind of critical data. For instance, you could say in 1988 there was an outbreak of this thing, and it is traced to particular person from Uganda. In 2005, there was another outbreak of disease. It was in Japan. It was traced to this particular part. I mean, those are the kind of things that give us a vivid, clear picture of the health challenges caused by migration, whether legal or illegal, whether regular or irregular. So these are the kind of things that give meat to the whole data that you are giving. But most of it, what you have seen, what I have seen, is a critical analysis of what should have been rather than what actually is. And then you also suggested that host countries must adapt by expanding lab capacity. Now, this recommendation or perception is probably based on the assumption that they have not done so. I would have loved to see cases where these host countries and evaluation of their lab capacity and the fact that influx of immigration is overstretching this lab capacity. For instance, Syrian refugees in Germany during the Syrian war. Now, there was a massive influx of Syrian refugees in Germany, and that might have impacted on the laboratory capacity. What is the evidence, if there is any, if it at all it has impacted on that? So, if there is a large movement of migrants, whether legal, illegal, or whatever it is, we would like you to tell us that because of these migrants, the governments in the countries have done this and done this in order to improve the capacity. But you are just saying that they must adopt by expanding. That means they have not expanded. That means they have not adapted. What is the evidence for not expanding and not adapting? Uh, Migration, you said, is undermining disease surveillance, which is true, quite true enough. But then people don't want to even report that they have a particular disease. In Kano here, for instance, we have people with HIV. They don't want people to know that they have HIV. And these are guys who will migrate to another country and spread that particular disease. How do we counteract something like that? So the consequences for migration is about coping mechanism, and this coping mechanism of these countries also will have to be documented. And then technological innovations. What are the examples of these technological innovations that deal with disease surveillance and so on? So I think these are some of my observations. But I like your flow. I mean, he is flawless. I mean, he really flows very excitedly, but he flows effectively. But the fact is that the presentation requires, in my view, some empiricism. But then I keep pointing out this empiricism in all the submissions that are made in this forum. And maybe it is me who don't understand what was going on. Because when you tell me that there is an impact somewhere, I would like to see that impact. I would like to see that impact measured empirically. I would like to see dependent variable and independent variable. Maybe that's a scientific approach. But that scientific approach will give you a greater anthropological appreciation of what is going on. So, but once more, thank you very much for your brilliant presentation. It was clear you're not reading from your PowerPoint. It's clear you have a control of the subject matter, and that's very good. Because you flew, but you overload your slides with too much text and so on. Too much text. Since you know the subject matter, since you flow, that's 3 lines. A PowerPoint slide should not have more than 3 lines, 3 points. That's why it is called PowerPoint, to explain. Now you are explaining brilliantly, but you have overloaded it even with references. Now nobody puts references. Tijani 2025 in a in a PowerPoint slide. It doesn't happen. Maybe probably this is how we do things here. I would like to say hi out, shout out to Godwin Sogolo, the grand old man of National Open University. Well done, sir.
Thank you very much. So let's hear from Professor Tijani now.
I want to thank
you,
you very much. Thank you so sincerely for that comment. The
Sorry, who is
former
making
Vice
this noise?
Chancellor Underwood. Can you hear me?
Yeah, you are audible.
Okay. Can Professor Obiegu mute, please? There's a noise coming from your hand. Mute if you're not speaking. I need mute. Okay, thank you. I think it's clear enough. I want to thank Professor Abdallah for that comment. He's based in Kano presently. I'm based in Baltimore presently. So we did not share notes, and we were not together. But we share the same in the spirit. I want to concur with all that is said, and I'll start by adding the following: that I love your energy, Professor Ibiagu. I love your audacity. And for me, learning occurred again. And out of this learning, from your presentation, I have comments and questions for me to be a better learner, because I do not know it all. And none of us that are making comment know it all, but we're just saying it in a different way. I want to add to the fact that in your presentation, you have given us, by my estimation, 4 or 5 papers. 4 or 5 papers could come out of your general introduction. It's like a general volume to the whole issue of health and global health and migration. That's the way I see it. But we're missing specificity that is so critical to understanding the nitty-gritty of what goes on in Uganda, in Nigeria, in Canada, in Australia, and what have you. And what do I mean? I think your introduction could have been well served by identifying or stating the obvious about the SDGs. That is my opinion. You may want to revisit as you submit the paper for publication, perhaps at the International Journal of Migration. And I love the fact that you are multidisciplinary. And of course, the director, Professor Neto, Gloria Neto, mentioning that, I kind of laugh, but I feel so happy, because she's one of the people that we convinced when we started during COVID-19. That is when the center started. And the National Open University was able to continue academic enterprise despite the COVID. I would also like you to look into the possibility of periodization. In historical context, we love period. And I think, if I can borrow from Professor Abdallah, looking at maybe, from X year to XY year will be so specific, and then we can learn more, okay, out of the general contextualization that you presented. You talked about global policy on medical, so excuse me, you talked about global health, but I did not hear about global policy within the context of the United Nations, within the context of World Health Organization, and then we can zero down to ECOWAS or African Union as a form of introduction to the general presentation. And I also stated here that you may zero in on COVID-19 activities if you want to be specific. And then look at the Nigerian National COVID-19 Research Consortium put together by the Ministry of Health then. I invited some of those members. We had about 9 subcommittees working in an interdisciplinary nature. You may want to, link up and then we discuss on that. It was a kind of 2 or 3 years activities by people from all over: medical sciences, anthropology, history, sociology. I have here also noted whether the main focus, your main focus when the flyer was sent out was on sustainable medical laboratories, okay, research. And I was asking myself until I now saw on table 4, which I consider to be another paper that you may, when you start dissecting, because you eloquently discuss that on that table, and then you can give more explanation, more analysis, both ethnographic specificity, in fact, alluding to that nurse of yours, the friend of yours that was a nurse that you lost, and so many others, within the context of what we call the biographical pedagogical discourse. In other words, you pick one person, and that one person, excuse me, in your specificity could really deal more or talk more about the challenges and the solution. Let me wrap it up. I don't want to take too much time by saying that since you are, I don't know whether you've done this or not, but please check the Ministry of Education, Diaspora Bridge. You need to register because your talent, your wealth of experience is needed. And I'm encouraging all of us to register because it is open to not just those in the diaspora, but also those that are based in Nigeria. But again, I thank you for adding knowledge. I thank you for sharing knowledge. And I really enjoy your energy and zeal to inform us about your research. Thank you very much, sir.
Thank you very much for your contribution. I'm sure our presenter will have responses to give. But before then, the third hand, after which I will allow our presenter to give responses. Then, if there are others, then we go ahead. I allowed him to stay for about an hour because he's a professor. And we had agreed on this platform before that professors can present for 1 hour. Am I right, Professor Tijani?
Absolutely.
Yes, so
There's a
okay.
continuity in
Yeah,
administration.
so
I
we had
love that.
agreed before. So except we are going to change it again, then that would be a story for another time. Thank you so much. So now, Professor Neto, over to you, sir.
Eminent scholars, today's lecturer, their colleagues. I'm happy that this lecture taking place, despite the faults, I may put it that way, some have found. But I want to preface my comment with an experience I had as a postdoctoral at the university. I worked with very distinguished scholars. Now, I said I was going to preface my comment with an experience I had as a doctoral scholar at the university in Japan. The project we were working on, each time my supervisor, Professor Fukushima, comes around, will give me some reprints. At times he write 400, at times 300, at times 500. I didn't really know what it meant. So someday I just said, could this be the number of publications they have had? And then I Googled his name. At that time, they said 675 papers. Now, this man at that time was the dean of the Osaka City University Medical School. He was the president of the medical center, which is called CMD. He was the chairman of the Department of Pathology, where I was fellow. and then he was the president of all Asian societies of toxicology at the time. So in the evening, because we had such a very busy schedule, most times we didn't meet until about 12:30, 1 a.m. Every day. So when I had your question, I said, Prof, is it that you have written over 600 papers? He laughed. He didn't say yes, he didn't say no. He said, and my papers still get rejected. And at that time, he was at least a member of 15 editorial boards. And that was all he said to me. And for me, it shows that no matter how much you think you know, or how exposed you are, and I think that Professor Kidani has also captured that, there is always room for peer review. And that is one excellent characteristic of academics. So many of the comments, some have passed. I consider them features of peer review that hopefully will improve the quality of the final manuscript. Now, with that said, I want to go on to the aspect that really thrilled me. Many people have this misunderstanding about migration. Today's presentation has, to a very large extent, fill the gap that probably exists. Many people wonder, what has migration got to do with health, with education, with whatever? But you can see that migration causes so many, and very significantly in health systems. I don't want to go over that again, but that's a very significant contribution. And many other things people are saying for me are minor features that will improve the quality of the manuscript. But I want to ask the presenter specifically. I know you have been to Uganda. Uganda, you have now crossed over to Zimbabwe. And then I hope that's not the final stop. And I just wanted to ask specifically about Uganda, because we have had a similar problem in Nigeria. Sorry, not Uganda, Zimbabwe. Zimbabwe is one of the mining nations. Why I'm asking this is because of what happened about, that was 2010 in Zamfara, when there was this problem of mining associated disease. Do you think that Zimbabwe and probably Uganda, where you came from, has structured its laboratory system to take care of this unique aspect of the economy, which is based on mining? I know South Africa has tried to do something, but I don't know what the situation is in Zimbabwe. I must say that I commend your presentation. Keep up the good work. Some of the points others have raised, you can take them seriously, improve yourself, and improve on the quality of the manuscript finally. Thank you very much.
Thank you very much for that contribution. So at this point in time, I would want the presenter to please say some things about what at least 4 people have said here today, starting from the director. Thank you.
Thank you, Prof. And thank you, the listeners, and thank you, professors who have commented and who have made their observations. I truly appreciate their observation. That is objective assessment, and that calls for improvement. So I will start with the comment from Professor Aneto. Yeah. Thank you for that comment, and thank you for that observation. And that is a sign of a great researcher. Actually, for the time, the period I've been here, I noticed actually one of their major, let me say, there is a high level of mining here actually going on. And I've been thinking of the implication to the health of the country and then the people within here. And even as you mentioned, pointed out Uganda, I observed some pattern that may be related based on maybe the mining and other activities that may be going on, and then trying to relate it with maybe the way the laboratory has been structured. In as much as I've not had the opportunity of seeing some of the laboratories here, but I always try to interact and ask some questions to understand how the medical laboratory here is structured. But from my own little observation, because just like you mentioned, the cases related to mining, and I know that the heavy metals also have some roles to play in some cancers, even though it's still something that I still plan to work on as research to have a real data on that. But when I try to get, I will always hear there is no documented data yet, and that means there is a gap which should call for research. But I know with my little knowledge of some of the causes of particularly the blood-related cancers, I know that heavy metals lodging into the bone marrow increases chances of some cancers, particularly leukemia. And I observe that a lot of people here suffer from cancer, and then it may be traceable to that, but we have to conduct research and be sure that there is an association between that and that. And then looking at the laboratory structures, yes, they have laboratories in different regions. From interactions I have with them, they have good labs, but there are some critical things that are needed to forestall some dangers that I think may need more opportunities there, may need more facilities, and then also closeness to the people. Every environment, they have a way they operate. The labs, from what I observed, is not the way it is in our place, where you can easily see laboratories everywhere, even though we may have reference laboratories. I noticed that they have fewer, but the fewer they have are good. Actually, the fewer numbers they have are good. And then the training institutions they have for training manpower for laboratory is not much. So I was asking the other day, it seems like maybe medical have started newly here, but they told me it is not true, because I participated in one meeting the other time. I realized that it has been 2 universities that have been training medical lab scientists in this country, and recently they added one to that kind of number of populations. So which means more work, more advocacy, more awareness will also be created to show them the benefits, the needs, the roles of medical lab scientists, and the role they will also play towards the migrants. And then, so likewise in Uganda, yes, they are also into mining, and that is part of why, and anybody who have gone there will bear me witness, time to time you notice some of them call it tremor, some of them will tell you it is earthquake, and it happens time to time, and they are not afraid of that. And I realized that when I was there, there are increased outbreaks of infections, a lot of infections. When I was there was an outbreak of
Can we put the phone on silent?
Ebola. So when I was there, I noticed that there was a time of there was an outbreak. Even when I came back to Nigeria, I have to go through strict monitoring or questioning and screening. at the airport because they know that there was a news for the outbreak. And even some of our medical students died within that process. I know that time to time they usually have, there was also a time they were now talking about monkeypox outbreak there. Time to time you always hear the outbreak. And then even the meat they sell, the people, the way they use chemicals on the meat also have an effect on the health, which also can affect the global health. But where there is a problem based, like relating it to the former director, the former VC, Professor Abdullah, his own areas, he raised the issues of empirical data. Yes, that is very important. When I was gathering my information, I was interested in getting empirical information or data for that, but looking at the main focus area, medical laboratory science sustainability there, I was searching to get some evidence data, something that would be so specific, but I couldn't get the kind of information I need, but I need to polish it more. I will go to that, I will look for more information on that. The only thing I was able to trace getting there is a publication made by the AMSIN and made by the Punch based on the number of migrants. But I know that even that number they are mentioning may not be actually the real number of some of the medical scientists that migrated, because not all of them are doing some works that may be directly related for them to get some recommendation from the council. And if they don't have that kind of link or documentation, you may not have the appropriate data or information to get to say that this is exactly the number that migrated within this period. And the documentation said last 5 years, that is 2019 to 2024, where this AMSIN president was lamenting that they need more workforce and also increase salary to motivate other ones to avoid we all know the syndrome we call a JAPA syndrome, which is happening there. So I appreciate that observation, and I'm going to improve on that. So, and then this issue of the relationship between this mining and then some of these outbreak and also the laboratory structures. I don't have a concrete data, and I'm also going to work on that because it's very important. It's a gap that we need to find out what is going on there. But from my own little observation, I know, but Zimbabwe is trying. They are doing great. Their hospital setting are very good. The way they operate is very nice, but I know that they will continue to do more. They will continue to do better. And then I also appreciate Professor Tijani for your observations, for your encouragement, and then some of the linkages, some of the networking that you mentioned that I need to contact, and then some aspects I need to polish, and some specificities I need to mention, like using the case of maybe COVID-19, and then maybe the Ebola, and then where you also emphasize the way I mentioned the death of that my classmate then as a result of Ebola, which is also a migration issue. And then where you mentioned that the table 4 can also be expanded to get a full-fledged paper, which I'm going to work on that. And very interesting, the Ministry of Education in diaspora that you mentioned that I should contact. I will be so interested to register with them, to work with them, to liaise with them. And then having you people, I know that everyone will bring the ideas as well back home and also contribute in developing our place. So some of the areas pointed out involving empirical information, I will search more to see whether I will get, but I know I have a limited data on the areas I was looking at, because it's not just looking at global impact of migration to global health, but relating it to sustainability of medical laboratory research and diagnosis. But I'm going to work more on that. And I say thank you so much. Thank you, Pros. Thank you.
Okay, thank you very much. you left out the very first comment by me, where I asked you that integrating migration into global health policy is very good, but is it that there is none or is not well implemented? What do you advise? I think I said that, and I also commented about mobile laboratory. Do you know the status of that, workability of mobile laboratory in Nigeria, or we're just using the international standard? I think that was where we started from.
Okay, thank you. Thank you. Sorry for I didn't intentionally omit your comments. Starting from whether there are the way the mobile labs, whether there is a proper utilization of mobile labs in Nigeria, particularly to handle migration issues. I may not say that it may be fully utilized, even though they also have the ones they have within the point of entry, particularly in the airport. But I think they always they are strict when they know that there is outbreak. But it is not something that is done regularly to curtail the spread or transfer of these diseases, either from outside or from within. So the way it is done is maybe when they notice there is an information in a country, like what I told you when I came in, they have to get some data. They asked me even how long I will be in Nigeria, where am I going to stay. So I know that some of this information is to monitor me, to track me in case I develop some signs showing that maybe I have Ebola, so that I will be quarantined and handled properly, so that I will not spread the infections to others. But talking of maximizing mobile labs in Nigeria, I don't think it is a fully utilized, because if it is utilized, so many causes will be speedily handled. Wherever the problem site is easy, of course, with this portable diagnostics, those screening should be easily done. And then issue of is there anything like, am I sure whether there is integration of migration to global health, the policies, maybe in Nigeria? I'm not too sure, but I think it's an area that our policymakers need to be encouraged to incorporate it, because it's going to go a long way in helping us for the future. Because even though we don't pray for outbreaks, but it will always help us, even if there's an outbreak, to curtail that. Because if we have proper documentation, like when Professor Abdullah commented that we noticed that there are irregular migrants moving from maybe from Kano, trying to cross the border from Libya to trying to move. And then it's not easy to maybe to stop these ones from migrating. But I think what we may need to do there is to create more awareness, enlighten people on the best way to migrate legally, so that if people migrate legally, before you travel, there are a lot of documentations you need to do. There are a lot of screening you need to do, and on the process, if the person has some infections, they will be detected that time and they will be advised accordingly. But when you have irregular, or what some people may call illegal migrants, if there are some borders that are porous, you may not stop them from migrating. And then even the security forces there, they are also human beings. At a time, they may be tired, they may want to sleep, and these people will also pass, and they may have a disease that they will carry to the other side, or other things that they might do, which we may not have proper documentation. I think for us to get track that is we have more awareness, more enlightenment, and then you see sometimes they are calling the young ones, there is a job here, there is a job there, and in actual sense, there may not even be like a job anywhere. It may be another thing they will see why they travel. So if we're able to enlighten them very early, maybe at secondary school, we give them proper education or enlightenment, I think anybody migrating will now follow the legal process. And then for the legal aspect, those that are migrating legally, there should be proper documentation. And with this, we can now have a good data, enough data on migration. You see, when I mentioned for medical lab scientists, apart from this report that the AMSI president gave, you may not have a proper documentation of medical laboratory scientists that have migrated. So even the one that I mentioned may not be the actual figure, because there should be proper documentation, and even researchers can now lay hands on all those things and then get a specific data or information which will be used for policy making. So I think it's a part of suggestion that should be given to the policy makers to take issue of migration, getting some data that can affect global health, and then it will also turn out to help the health of the nation and the health of the world. Thank you, Prof.
Thank you very much for your time, for your education. I really appreciate all this, and I'm happy you came on board. I can see that there are no more hands up, and actually, it's almost 2. So I think we have really stayed long enough for today's discourse, and I really appreciate you, and I appreciate all the people that contributed to this presentation to make it better for our presenter. And like you heard, we have a journal in this center, and the journal is International Journal for Migration and Global Studies. So you may wish to get this your presentation. It may not be every part, since you want to make it specific to a particular area, and then you write it up with some data, and following our guidelines, you present it to the journal. It undergoes a peer review, and if suitable, it will be published free of charge, and a copy will be given to you free of charge. So we are very good here. We reach out to people, so we make things happen. So consider writing up the paper, and we take it from there. Thank you so much, everyone. Like I said, October 14 and 15, if you're an academic, if you're interested in migration issues, the way those of us in the academia would want to work and do research and make it better, you are most welcome to be part of us at the National Open University of Nigeria for those 2 days workshop. And I say those who are in the diaspora, if in case you are around, you will be most welcomed, because we all need to put heads together to talk about the position of the academia in migration issues. We really want to talk about our position. We want to take the front seat and no more back seat, because it's been always said that in the academia, people take back seat in migration issues and thinking others should be the ones doing it. But here we have said many things today: research, this policy issue. Yes, they have just reviewed the policy issue on migration nationally, though it has not been signed, and so it has not been effective, because it's now in the Assembly, House of Assemblies, Senate, and all those people going through its procedural. But then there's a framework there they are considering. And if we find anything that we think should be added, we can actually write and we give this to the consultants. I happen to know the consultant that was invited to lead the team on reviewing migration policy in Nigeria. So we are here, we can bring our own contributions. It may not be too late, because by the time we are not doing final draft, we may be able to chip in 1 or 2 things and let us write something. So just on that note, I want to say thank you very much again, Professor Emmanuel Obiagu. And I don't know whether you have any last thing to share with us. If not, I want to bid everyone bye-bye. Any more last thing? Any comments from you, sir? Anything?
Yeah, thank you. Thank you, Prof, for the opportunity to present in your center. Thank you, all the professors, all the listeners, all that came to join us today. I appreciate all of you, and I say thank you and remain blessed.
Thank you so much. So outside here, we can talk more. Thank you, Prof. Thank you, everyone. I wish you a very blessed day, everyone. Thank you for joining. So on this note, I say bye-bye.